Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great start to your day here. And let's say hello to a few dear friends before we get going this morning. And who's number one on the hit parade this morning? Mike from Norland. Where's Brahim? He is number, let's see, here we go. Number 2 today. And Teresa from Calgary, good morning. And Lori, how are you? And April, good morning. And Lori Lee from Ventura, California. And Janice from Brampton. John, or Johnny. Nick from our staff. And Kevin, Oshawa. And Fran from Orangeville. Mary from Norwich, good morning. And Donna from Park Hill. Yalang, bonjour. And Rosalinda, rainy Niagara Falls. Wendy from Markham. Crystal, Aurelia. Bruno, how are you? And Frida. And Sandra. Keith, good morning to you. And Donna from Newfoundland. And Gary from Bolton. Judy, how are you? And Diane from LaSalle. Marilyn from Edmonton. And Bonnie, good morning. Nancy, Gore's Landing. David from Florida. And Sandra. And that was, I can't see, I think it was Rose. Barbara, Kansas. Suzanne, Edmonton. And Yvonne Petawawa. Good morning. Few more here, guys. Maggie, how are you? And Sandy from Vancouver, Washington. Marcia from Mexico. David, Gilmore. Judy, Mitchell. And Maggie from Kansas. Rose, good morning. Connie, how are you? And Nativity and Rosa. Milika. Francis, how are you from Vaughan? And Victoria, okay, guys, thanks so much for coming on. Verna and Yvette, Meadow Lake. And Nativity says I got to call her Linda. Kathy and Maureen, Penticton, British Columbia. And Brenda, good morning. Okay, because somebody asked me a few questions. Heather, Miramichi, how are you? Jean, Bonnie, Manitoulin Island. Dave from Muskoka, good morning. We love you guys. Thanks for coming on. Let's talk about doing a spring cleanup. Okay? Your body. Let's do a detox together. Okay? And guys, a lot of people, look, one of the things that detoxes you more than anything else is water. Okay? So water just flushes out. That's why, especially the kidneys, water. And you know, you guys know what I think of Niagara Falls. When you go there, you go and watch the falls. And that's the way water will, water's constantly going, whether you go 2 in the morning or 2 in the afternoon, don't matter. Water is flowing at Niagara Falls. That's what your kidneys need. Kidneys are huge detox organs. Your lungs too. Kidneys more, and even more than your kidneys, your liver. Okay? Now I'm just going to take up a picture here. Okay? So for those listening on a podcast at a later date, well, I want you to visualize this organ. I'm going to show you the liver. See that liver there? What happens in the liver doesn't stay in the liver. Okay? So the liver is a very important organ. I mean, it's incredible what the liver does, okay? And the liver is the area that your body produces probably the most hormones. And it produces cholesterol in the liver and bile. And your liver is so important. You cannot live without your liver. Your liver is so important to you that even if you literally cut a piece of it off, it'll grow back. But today we have so much liver problems, even in children, because of high fructose corn syrup goes directly in the liver. It impacts the liver big time. Toxins. You know, we talk about microplastics. We talk about, let me just get you the newest thing on microplastics here. I read this the other day, and I have it here somewhere. You know me and my notes. Okay, new research. 17.1 trillion plastic pieces are contaminating our oceans. I don't know who counted. 17.1 trillion pieces of plastic. Microplastics are like a sponge. They pick up pollution, pesticides, bacteria, heavy metals, and linked to autoimmune, cancer, Alzheimer's, and diabetes, lung diseases, heart diseases, chemicals in plastics. This is an article I'm reading from. The bisphenol A and the phthalates, hormone disruptors, and they decrease your testosterone in men, increase estrogen in women. Okay? Studies show we consume, eat or drink and breathe 211,000 microplastics each year. And they're found everywhere. Okay? They're found everywhere. So, I think it's a good idea to do a spring cleanup. What a better time to, as people think of a spring cleanup, the place you want to clean up is your liver. And the best thing you can do to clean the liver is to empty the liver. Okay? People have asked me about milk thistle. I like it. I find even better is curcumin. Okay? Curcumin is better, in my opinion, than even milk thistle. But at the end of the day, what's even more effective is if you empty your liver. Empty your liver of fat. Okay? So let me just show you, by way of illustration, 5 pounds of fat. Look at it. It's just 5 pounds. But when that gets in your liver and it gums up your liver big time, your liver has trouble detoxing. Can't detox properly. And, one of the things your liver does too, it's a storehouse, right, for vitamins and minerals. And when you need them, or extra bile, it's available. But again, it depends on the health of that liver. So when you think spring, one of the biggest things, you remember this, but the reset, the metabolic reset, 30-day program, the biggest reason it was ever created is for the 93% of the population that have some form of metabolic syndrome. Now listen to me. If you have elevated triglycerides and low HDL, you have metabolic syndrome. You got a liver problem. You got a liver problem because this is where it starts. Starts in the liver. The liver gets gummed up, full of glycogen, full of fat, and now you got no room. You got no room for detoxification in there. It will be sluggish, a sluggish liver. So one of the benefits, and it only takes a week of the reset, is to literally empty the liver. And the benefits of that are enormous, okay? So I just wanted to talk about it because somebody asked me the other day, and it's really important to empty that liver. Water for the kidneys and water for the liver too, because water is so good for you. And most people are dehydrated. They don't know it. But water cleanses. There's no doubt about that. And only water is water. You know how I say that all the time. Okay? So, I thought I would just start off the program today with that. Okay? Now, I posted this yesterday. Another win for coffee. Another win for coffee. And, hey, don't come after me. I am just giving you the studies, okay? The studies are legion on coffee. They're unreal. Okay, here's a new one. I posted this yesterday on our private Facebook group. Coffee consumption lowers the risk of melanoma. Melanoma by 20%. Coffee is anti-cancer. They've already shown studies where coffee lowers your risk of pancreatic cancer. I tell you guys that there's one of the best things you can do with your meal is drink a coffee because it acts like metformin. You don't need the drug when you can drink coffee. I went into a Starbucks the other day. There must have been 50 young people in there. And at first I go, this is a good thing. Until I find out what they're ordering. They're not ordering coffee. It's a candy shop. They're getting all these sugary drinks. Worst thing for your liver is a sugary drink. Okay? Worst thing for the liver is sugary drink. But what does coffee have to do with melanoma? Melanoma is the deadliest form of skin cancer. Coffee is such a powerful polyphenol. Poly means lots, many. It is a powerful antioxidant. A rust proofing of your skin even. Imagine. You know what I like? You know what I really like? Is you get a bonus. You know, because sometimes, you know what? This is good for me, but I don't like it. You know? But isn't it a wonderful thing? It's almost too good to be true. That coffee is the real vitamin C. A 20% reduction in melanoma with coffee drinkers. And by the way, I always put this in. Melanoma is not caused by the sun. It's actually caused by the lack of the sun. And my personal opinion is that when you put sunscreen on, these chemical sunscreens, you're asking for nothing but trouble when it comes to skin cancer. Okay? I know this, you know, for the last 50 or 60 years, they've been talking about using sunscreen. I don't like it, to be honest with you. okay? To be honest with you. Cover up. After you've had enough sun, cover up. But coffee will help. So have a coffee in the sun. If the weather's nice enough, get out on the deck and have a coffee and get some sun. New study. Okay, now, let me see. I had a couple of more that I wanted to talk about. And, oh yeah, yesterday we spent some time on vitamin D. Man, oh man, oh man, oh man. It is unreal. Like just every day, it seems to me, I pick up a new study on the significance and the benefits of vitamin D. Listen to this. This was a combination study, and I really like it, on schizophrenia. Okay? Again, mental health, we're not, I always say we're not winning the war on cancer because we're looking for love in all the wrong places. Okay? We're not winning the war. It's getting worse. What did I tell you yesterday? Hold on. Let me just bring this to you for those who weren't on yesterday. Global cancer rates to jump 77% by 2050. Holy moly. Their prediction. Global cancer rates will increase by 77% by 2050. So I said yesterday. I won't be alive. And someone on the private Facebook group or whatever said, Dr. Martin, you'll only be 100 then. I'm not going to be here with them. I'm pretty, you know how that, every time you watch a sporting event now, you get the bet on it. Like, and then, then they have and part of the commercial is, oh, if you have trouble betting, call someone. Like, if you're an addict, but then they push betting. But guys, if you want to bet by 2050, I can tell you, I ain't going to be here. I can almost guarantee that. Okay? Now, okay. That was just kind of funny because somebody said, oh, Dr. Martin, you'll only be 100. Yeah, you know what? I've told you what I think about aging. Okay? And I want quality, not quantity. Okay? I don't want to be around, guys, if I'm not healthy. If I don't have my brain, I don't want to be around. People that, I'm going to live. My uncle lived till he was 110. And he smoked and he drank and he did whatever he felt like. You know what? Forget that, okay? Like when people tell me they don't take care of themselves and they're just playing Russian roulette, that's all they're doing. And, by the grace of God, some people live longer than others. You know what? Don't play with that. Anyway, okay, why did I get on that topic? Oh, global rates, cancer rates, to jump to 77%, or to jump by 77% by 2050. And here's another one. I don't think I mentioned this yesterday. Cancer rates rising in young people due to accelerated aging. Okay? American Association for Cancer Research says, cancer rates rising in young people due to accelerated aging. Okay, but why are they aging rapidly? Sugar, my friend, sugar. And the new sugar, high fructose corn syrup. I'm telling you, that's the biggest reason. Yeah, the microplastics and all this and that, that we live in, good luck trying to get rid of it. But I'm telling you, it's a big problem, okay? Now, let's get back to the vitamin D studies. Two of them. Okay? Schizophrenia. Here's what they did. And they said a treatment of a combination. I really like this study, guys. Okay? I really like this study. What they did in schizophrenic patients, they used placebo on one side, and they used a combination of vitamin D and probiotic. I like that. And they found a significant, I'm just going to read you what they found, a significant boost in cognitive function in schizophrenic patients compared to placebo. Okay? Now, here's my little asterisk that I always put beside mental health. Bipolar, schizophrenia, depression, severe anxiety, whatever. The problem are you going to do it or not? You know, a schizophrenic patient, so often they are bipolar or whatever, they don't want to take their meds. But I think when they do, if they would give them vitamin D, put them in the sun, and probiotics, they do really well. Really well. Hey, it's not just me saying it. And let me give you another one on vitamin D that I just picked up. Like I said, it's almost every day. This is with Parkinson's, another neurological, neurodevelopment problem that is like an epidemic today, Parkinson's. And again, we go on one side, we know about all the toxins that we live around. Okay? Now, here's what they said. A 61% lower risk of Parkinson's found in individuals whose vitamin D levels was 20 ng ml or higher. See, 20, that's an American number. 20 ng ml. Okay, in Canada, it's 2.5 times that. Okay, because we measure in MNOL. Okay, we measure differently. So you look for different numbers. Whether you're in the United States, if it's in the United States and you're 20 and above, okay, this research showed you have a 61% lower chance of getting Parkinson's. And in Canada, that would be somewhere around 75. And guys, that's low. That's not optimized at all. I like 60 and above in the United States in terms of your vitamin D numbers. And I like in Canada, around 150, 200 level. Now you're optimizing your vitamin D. But the research on Parkinson's is pretty clear. There's a big association with your vitamin D levels. You know, it's another win for vitamin D. Very inexpensive vitamin. Really a hormone that you need. Okay? Now, let me bring this one up. Do I have time? Yep, I got time. Let's do one more. And this is on autism, okay? Now, remember when I was in school, okay, I never studied autism. We studied some neurodevelopment problems, but not specifically autism, okay? Like we knew about ADD and ADHD, not like we know today, but we did. You know, kids that were hyper and whatever. It was minimal compared to where it is today. But autism is, in the last 20 years, has gone up 400%. Now, I know we're better at detecting and diagnosing, but that doesn't account for a 400% increase in autism. It's crazy. What's happening? Now, I've always said this, okay? And I've been consistent. What is responsible for that? Why do we see a 400% in the last 20 years rise in autism? Okay? Why? And guys, I bring it back to the gut. It's the microbiome. You know when politicians say, it's the economy, stupid? I tell the world out there, autism is the gut, stupid. And I don't mean stupid to you, because you guys are the smartest audience on social media. You. Okay? But it's the gut. And listen to what they're saying. Disturbances in the gut microbiome, okay, in infancy are linked to later life development of neurodevelopment disorders like autism and ADHD in a study of 16,000 children. What happens in the gut has a major effect. And guys, I know this is what the study said, okay? Like it just confirms what I've talked to you about. Okay? Now, I'm not saying, you know, when I was a kid, you know how many vaccines they gave out? 2. Now it's 70 by the year of 2. Look, guys, I don't think we need that many, but that's not the point. The point is, and I've said this again and again and again, what happens in the gut is very, very key. Any autism, in my opinion, starts with the microbiome, and this study is confirming what I'm saying. And you know what they're saying? I've said this 50 years ago. Here's what they're saying. Antibiotics for ear infections is a big factor. Hey, guys. A kid gets an ear infection. A baby can't stop screaming. And doctors should never, ever give an antibiotic for an ear infection because it's 99% viral. Oh, yeah, but Dr. Martin, my baby got better. Yeah, but your baby was going to get better anyways. You're better to give some painkiller and perhaps an antihistamine. Very temporary to reduce the pain. But at the end of the day, it's the antibiotic that wipes out all the friendly bacteria according to this study. It changes the microbiome. And that affects their brain. Leaky gut, leaky brain. And these kids are canaries in the coal mine. You know, antibiotics don't cause neurodevelopment problems in every child. But this study, they did a study of 16,000 children, and they realized that their microbiome had been affected. Their gut microbiome. You know, and I can't emphasize mama. I always appeal to mothers. Mama, okay? Mama, you take probiotics. You take them. And then breastfeed your baby. And the baby will get the probiotic right from your breast. Okay? And, you know, it's not, I'm not a woman, so, you know, I know there's different reasons. But, and the other thing, and I wrote this in a book. I'm trying to think which one I wrote it in. I actually put it out there that one of the biggest problems is with a C-section. And it wasn't me that said this originally. But the problem with a C-section is that baby doesn't get mama's microbiome in the canal as it descends. And they're saying that, you know, these studies are saying that contributes to autism. Wow. Okay. That's a significant development. Not for me, because I've been saying it for a long time. But it's confirming what I said years and years and years ago about leaky gut. Baby gets leaky gut. Toxins get in the bloodstream and travel to the brain and cross the blood-brain barrier. Anywho, okay. Now what is tomorrow? Question and answer Friday. Send your questions in. We appreciate those questions. We thank you for those questions. It makes our Friday session, and sometimes Monday too, depending on how far I get, makes them quite interesting. Okay, guys, we love you dearly. We'll talk to you soon.